The question reads, knowing what you know about diabetes mellitus type 2 is, and then you have a series of 10 statements. Now this question is testing your knowledge in two areas. The first area is anatomy and physiology, and the other area is knowing the difference between type 1 and type 2 diabetes in terms of characteristics. So let's take a look at some of the important differences between type 1 and type 2 diabetes. One major important difference between the two is their cause, or the pathophysiology of the disease. Now, type 1 diabetes is caused by a complete destruction of beta cells in the pancreas. So individuals with type 1 diabetes are no longer able to produce insulin at all. And so they're dependent on an external source of insulin through insulin injections. So if we scroll down to the bottom of this table here, we see dependency, yes, insulin dependent. Treatment, insulin injections. So that's one of the major differentiating characteristics between type 1 and type 2 diabetes is type 1, individuals with type 1 diabetes, their beta cells have been completely destroyed and are no longer producing insulin at all. So they are completely dependent on external sources of insulin through injections. In contrast, individuals with type 2 diabetes, their beta cells are there and are working, but they're not completely effective or efficient. So individuals with type 2 diabetes, their beta cells are producing insulin at a lower level, or insulin that is not really effective. So if we scroll down to the bottom, we see that they're not dependent on an external source of insulin. That's because their beta cells are still producing a little bit of insulin. And so the treatment for these individuals is usually lifestyle changes like diet, exercise, weight loss, and sometimes these individuals will also take oral medication. So those are the major differences between type 1 and type 2 diabetes. And if you look at the symptoms as well, they share a lot of the same characteristics in terms of symptoms, and type 2 diabetes might have some additional characteristic symptoms as well. And then we also see that type 2 diabetes is the more prevalent type of diabetes. 9 out of 10 cases of diabetes are type 2. And then we also see a difference in the target groups. Individuals with type 1 diabetes is found more predominantly occurring in children and teens, whereas type 2 diabetes usually develops later in life in the elderly, and then certain ethnic groups as well, research shows. So if you need a minute to review this table, pause the video now. Okay, so if you're done reviewing the table, that was the difference between some of the important, that covered some of the important characteristics that differentiate type 1 and type 2 diabetes. Now the second part of the question deals with the anatomy and physiology, or the pathophysiology of diabetes. And if we look at this diagram here on the right, we have our pancreas, and in the pancreas, now remember, the pancreas is a dual organ. It has exocrine and endocrine functions. The exocrine functions of the pancreas are to secrete pancreatic juices and bile into the duodenum, the first part of the small intestine. So you can see that here in the diagram. You see these ducts coursing through the pancreas and as well coming out of the liver and the gallbladder, and emptying their digestive enzymes into the duodenum. Now that is the exocrine or digestive function of the pancreas. The other function of the pancreas is to regulate blood glucose levels, regulate blood sugar levels. Now two of the cells that do this, two endocrine cells that do this, are beta cells and alpha cells, and they both secrete a hormone. Beta cells secrete insulin, alpha cells secrete glucagon, and these two hormones, insulin and glucagon, they regulate the levels of glucose in the blood. So remember, it's very important that our blood glucose levels remain within a certain range. This is the homeostatic range of blood glucose levels, and that is usually between 75 and 110 milligrams per 100 milliliters of blood. Now, if blood glucose levels get too high within our blood and get up to around 126, then that's when a person is getting into the diabetic range. That's when they're becoming hyperglycemic, and anything below is hypoglycemic. So our beta cells and our alpha cells regulate the level of glucose in our blood. If our glucose levels get too high, then our beta cells secrete insulin. And so insulin gets into the blood, and it causes our liver cells and our muscle cells to absorb more glucose. So we're taking glucose out of the blood. So the result of that would be lower levels of glucose in the blood. And it also causes a conversion of glucose to glycogen and fat. So if our cells are taking up the glucose and converting it to glycogen and fat, then that's also reducing the level of glucose in the blood. So the primary function of insulin is to decrease levels of glucose in the blood. And then glucagon does the opposite. When our blood glucose levels drop too low, alpha cells secrete glucagon. Glucagon increases levels of glucose in the blood. So they work in tandem and in opposition to each other. So now let's look at the solution to this question. So knowing what you know about diabetes mellitus type 2 is, okay, so the first one, the alpha cells of the pancreas are not secreting any insulin. So let's look over here at the diagram. Are alpha cells secreting insulin? No, alpha cells secrete glucagon. So that doesn't even make sense. So, whoops, we can see. Okay, good. So we can scratch that response out. Alpha cells do not secrete insulin. So that doesn't make sense. Number two, the beta cells of the pancreas are not secreting any glucagon. Beta cells are not secreting glucagon. Again, that doesn't make sense. Beta cells secrete insulin. So let's scratch this one out as well. Okay, number three, the patient may need to take insulin on a regular basis. Okay, this is going back to the characteristics of type 1 and type 2 diabetes. An individual with type 2 diabetes may not need to take insulin on a regular basis, and if they do need to take something to regulate their blood glucose levels, it's usually an oral medication. So individuals with type 2 diabetes usually do not have to take insulin at all, let alone on a regular basis. So this is also incorrect. Okay, good. Number four, a form of diabetes that is typically developed at a later age in life. Okay, that is correct, right? Because type 1 diabetes is found more predominantly in younger individuals, and type 2 usually develops later in life, found in elderly, older people. And we can look at that from the, if we go back to our table, the beginning stages of the video. So that is correct. Number five, alpha cells of the pancreas are not secreting enough insulin. Alpha cells do not secrete insulin. So that is also incorrect. Scratch that out. Okay. 6, beta cells of the pancreas are not secreting enough glucagon. Beta cells do not secrete glucagon. So that also doesn't make any sense. Number 7, beta cells of the pancreas are not secreting adequate insulin. Beta cells secrete insulin. Okay, so this could be correct, right? So beta cells of the pancreas are not secreting enough insulin. And if we go back to that table, we remember that's one of the main causes of type 2 diabetes. Individuals with type 2 diabetes, their beta cells are either not secreting enough insulin or the insulin is not as effective. So that is also correct. Individuals with type 1 diabetes, their beta cells are completely destroyed. They don't secrete any insulin at all. So number 7 is correct. Number 8, the patient likely needs to take oral diabetic medications on a regular basis. That is also correct. Number 9, a form of diabetes that is developed in childhood. No, that is type 1 diabetes, so we can scratch that out. And then number 10, alpha cells of the pancreas are not secreting enough glucagon. So alpha cells, yes, they do secrete glucagon, but alpha cells and glucagon have nothing to do with diabetes. Diabetes is caused or has to deal with beta cells and insulin. So this is also incorrect. So if we look at the responses that are left, 4, 7, and 8, and so the answer 4, 7, 8 is B. The answer is B.